Welcome to Learning Unit number 12, and this is on disease prevention. And we're specifically looking at nutrition this week. So you're going to be reading chapter 7 of your text. And as we look at nutrition, we understand that nutrition or poor nutrition, unhealthy diets, along with sedentary behavior, are major risk factors for many non-communicable diseases. We call them NCDs, non-communicable chronic diseases, such as cardiovascular disease, diabetes, obesity we're going to look at, and cancer and respiratory disease. So you're watching this video right now for the learning unit. You're going to be reading chapter 7. You'll be doing a discussion board post. No reply. I'll be taking that out when I'm done with the video. And continue collaborating with your group members, as at the end of next learning unit number 13, you're going to have completed with your group members your screen pal video of your final group presentation. So you want to make sure you have a date and time set that with your members so that you can complete this video presentation. It is going to be due at the end of learning unit number 13. So let's look back at the content for this week. So CDC has a link and it has information about preventing chronic disease. Remember, we're talking about disease prevention, but we're looking at this website, and it's worthwhile looking through a little bit because you can find some good materials, education materials, tip sheets, etc., for your specific health promotion program. Then if you click on to this 2-minute and 37-second video, it is an excellent video that ABC News did this year. Obesity in kids and teens. While it's very short, it's powerful. It talks about the obesity rates in our children in the U.S. and teenagers. And the individual being interviewed also ends by talking about GLP-1s, the medications that have come out that for weight loss and for diabetes care as well. So we are going to look further at that. But let's start with nutrition. And this is entitled Forget Fad Diets. So if you like to read something, you can click on here. But if you just want to listen to this video, it comes from Medscape. So it is an excellent source. And you can click on the physician here and listen to him talk about the Mediterranean diet, where there is a wealth of literature, of research to support that this diet, Mediterranean diet, eating according to the Mediterranean diet, is the best nutritional way to eat that is supported by the literature. So you can listen to him or you can read the PDF. If you're listening to him, there's still beneath that is the transcript, so you'll still be able to read it as you go along. And then this is a link from the Mayo Clinic on the Mediterranean diet. What is it? What are the foods? Why, further evidence to support the Mediterranean diet. Next, you're going to go from the Mayo Clinic to Cleveland Clinic. These are two really good sources of information for the layperson and really for the student, a nursing student. So we're going to look at GLP-1 agonists, and you're going to need to know this information to complete your discussion board. So let's just click off here for a minute and let's look at what is the discussion board for this week. Remember, there are no replies. And this comes from that link I was just on, the Cleveland Clinic, and it's in quotes, so you can tell I am citing this. Obesity is a complex condition. Okay. And we know that treating obesity may require several different therapy types: nutritional changes, the Mediterranean diet, exercise, medications such as the GLP-1s, behavioral mod programs, and also bariatric weight loss surgery. With the medications, we're finding less need for the surgical procedures. But we're going to continue on. You're going to answer 2 questions. You're going to share a summary of the evidence that supports the Mediterranean diet as a nutritional intervention for obesity or preventing obesity. And then you're going to, and that the physician that's interviewed, that's a great source of information, along with the Mayo Clinic's information about the Mediterranean diet. And then you're going to select one of the GLP-1 agonists, either semaglutide or liraglutide. These are the generic names. Or there is one GLP-1 slash GIP receptor agonist called tirzepatide, and you're going to pick one of these. And you're going to share about one of those, but only one of these, because these are the GLP agonists that work to treat obesity. They may also be used in the treatment of diabetics, but they have been approved for the diagnosis of obesity without diabetes as well. So how do they work in the treatment of obesity? What are the benefits, possible side effects, and really anything you want to throw in there as far as that really stood out for you? No reply is required, but I do hope you read a few of your colleagues' posts. So in order to do this, you knew about the Mediterranean diet. We've got those 2 things here you're going to go through. This is where you go on the Cleveland Clinic, and it talks about GLP-1 agonists. What are they? What do they do? Here's the overview. They can also be used to help treat obesity, but many of them are used for type 2 diabetes. Some of them, in addition to insulin for type 1. It talks more about these. Here's a list of the agonists. The reason that I have you looking at liraglutide or semaglutide is because those are the 2 that are approved for a diagnosis of obesity with or without diabetes. There is also a similar class of medications called the GLP-1 GIP receptor agonists, remember? And the generic name is tirzepatide or Mounjaro. There is also Zepbound. They must not have updated their website recently. Zepbound is the other trade name for tirzepatide. And they're finding this medication to be one of the most effective for weight loss. So just sharing that with you. So most of them are GLP-1 agonists, but yet there is another grouping called the GLP-1 slash GIP receptor agonists, just to confuse everybody. How do they work? And if you want to choose this one, you can click on right here. How do they work? This is very good information. You want to share some of this. For then, like, when would I need to take it? You can kind of skim through for the type 2 diabetes, because remember, we're focusing on obesity. So GLP-1 agonists for obesity, and you'll see the 2 that I had asked you to look further in, or you could choose from one of those. And who meets the condition for treatment. And it even includes, BMIs of body mass index. And then we know this is where I got the information that I put on that I cited on your discussion board post. So how often do you take them? What are the risks of the benefits? And as you remember, we talk about non-communicable, chronic disease, NCD. So we know that obesity, diabetes, sedentary lifestyle can lead to hypertension, lipidemia, high lipids, heart disease, diabetes. So we understand that. So therefore, the potential benefits are to lower blood pressure, improve lipid disorders, etc. But what are the side effects? You need, as nurses, to be knowledgeable about the common side effects, and then complications and allergic reactions. We're not really going into the pregnancy and hypoglycemia, but there's that information there. So this is um, an essential website for you to go on. So remember, you have two parts to this discussion board. And then don't forget to get with your group and plan to do your Screen Pal video presentation where all members are speaking. I can hear. I'd love to see your faces, as well as you can use your screen. So you can set it up with the instructions that are available to you to either have just your faces or faces and screen or just the screen. I'm highly recommending that you put faces and screen, but you do need to do Screen Pal because that will allow us to have the link. And I've explained that before. Next week, learning unit number 13 is when you're going to submit that. And then we are going to be on a Thanksgiving break. When you come back in week 14, it's a very short week. It is our final week, but you're going to be looking at another group's presentation and critiquing that. And we're going to be then on to completing the final course reflection. So we're getting much closer to the end. We're getting close to the holidays. So get together with your group. If you want to submit your link early, you can do that. If you have any questions, please do email me. Have a great week and enjoy learning about GLP-1s and the Mediterranean diet and looking for additional information on the CDC's website for your health promotion program.